Welcome back to Bay Sunday. Each year, some 8 million people go to the doctor with shoulder problems from work or playing sports. And now there's a cutting-edge technology that makes shoulder replacement a thing of the past. And here to tell us about it is Dr. Mark Schrumpf from the San Francisco Shoulder, Elbow, and Hand Clinic. And he brought along his patient, Mary McSweeney. Welcome to Bay Sunday.
Thank you.
Hi, thank you.
So tell us, Dr. Schrumpf, a little bit about this new technology that we're seeing.
So this is a technology we're using to treat proximal humerus fractures or fractures in the shoulder. And what makes this technology new and exciting is it allows us to fix fractures which in the past we might have had to treat with a joint replacement. It really allows us to push the envelope in terms of what we can put back together now, whereas before we may have had to do a joint replacement. Getting people's own bone back together and healed really helps maximize their recovery and helps improve their kind of long-term function.
And what about you, Mary? So you underwent this procedure
Yes.
fairly recently. What was the injury that you suffered, and how did it go on from there?
I had a very bad fall and fractured the humerus on both sides, and needed, a surgeon, a good surgeon. And my recovery is ongoing, but I am so much better. I was out of work for 2 months, back to work part-time for 6 weeks, and then back to work full-time after that. So it's been a journey, but
Right.
physical therapy, everything has helped.
And Dr. Schrumpf, compare Mary's procedure to something that would have been done traditionally. How long does the recovery process take with this new technology versus what we would have done maybe 10 years ago or even 5 years ago?
The major difference that we see now is we're able to put people back together and have their own parts in. And so the risk of future surgery or revision surgery is much, much lower, we feel, with this procedure. We're able to support the proximal humerus with a cage, so if there's a fracture gap and you're missing bone, you can have support inside the bone. Additionally, you can fix pieces that might be broken on different sides of the bone with screws that aren't necessarily just through the plate. And that's really revolutionary about this technique. It allows you to fill the inside of the proximal humerus with supporting structure, a bone that's otherwise fairly empty, with something that has a fair amount of integrity to it. But we're able to do that all through a very small hole in the side of the bone where we place that cage.
And you were showing us this tool that you actually used during this surgery. Explain to us how it works, because people are kind of confused about how you can. Absolutely.
So through about a centimeter-sized drill hole in the side of the humerus, we're able to deploy the cage. It looks like we're showing a video of the actual surgical technique, and you can see here a cutaway of inside the bone. You might have this proximal humerus cage, and it's used. We use screws to fasten each of the fracture fragments back in place around the cage.
And so this is called PH cage technology.
Right, PH for proximal humerus.
Right, and how did it develop?
It really came from vascular stents. We kind of borrowed their technology of being able to deploy a metal cage or a metal supporting device from a small tube. In this case, we're able to make that centimeter-sized hole in the outside of the bone, and through that, you're able to deploy a much larger device, and then we can then place screws through the device that provide structural integrity for the actual small pieces or small chips of bone that are important to put back in place.
And what made you decide to actually start using this technology? Because it's not technology that's everywhere. A lot of doctors are using right now in the Bay Area.
Absolutely. I was the first physician in California to put one of these in. And the reason I was excited about this technology is I trained a lot in shoulder joint replacement, and I saw how many of these patients need to come back on a fairly regular basis because their replacement either gets infected or the parts become loose or they wear out. And trying to treat some patients who have fractures who in the past I might have treated with a joint replacement with a fracture surgery to get them kind of one and done and back to their lives was really something that was exciting for me.
And does insurance cover most of this this type of surgery?
It covered some.
Right.
Yes.
Okay. And how are you doing?
I'm doing really well, thank you.
Okay.
Back to all my normal activities and very grateful.
And grateful for this new technology that we just talked about. All right, Dr. Schrumpf and Mary, thank you so much for joining us here this morning. Thanks for sharing your story. Appreciate it. You can get more information on the San Francisco Shoulder, Elbow, and Hand Clinic's website, sanfranortho.com. And when we come back, you'll meet a Bay Area CEO who calls herself a serial entrepreneur when Bay Sunday continues. Thank you. Thank you. Oh, stay in your seat. Stay in your seat.